Hi, my name's Amar Alwitry. I'm a consultant ophthalmologist here at Circle Nottingham. Part of the service we give is mainly about cataract and refractive surgery and also lid surgery as well. Ophthalmology is eyes, so it's eye surgery and eye medicine. Most of the surgical work we do here is cataract related. So people who have age-related cataract, but also younger people who want to get rid of spectacles, we see them, we assess them with the highest technology, and then we operate on them to place a brand new lens back into the eye. So if you're very short-sighted, very long-sighted, or have astigmatism, we can set it so you can walk around without your specs on. So it's really life-transforming stuff. When a patient first comes in, they're usually referred via their GP or their optician, or they are self-referrals. A lot of people know they've got a problem and want to seek a second opinion or explore options. When they come here, first of all, they see my nursing staff and they undergo a whole barrage of tests. They have drops in, they have some clever scans of the cornea and the eye itself to work out the length, the curvature, and every aspect of the eye that I need to know. Then they see me and then we talk about nitty-gritty. First of all, we've got to make sure that the procedure is right for the patient. Not every procedure works for every patient, and so it's important we fully assess them, understand their needs, understand what they want to achieve. Surgery is not risk-free and people have to know that, but thankfully the safety profile here is fantastic, and so I have no qualms about offering people surgery if they're the right person for it. Once we agree a plan together, then we move forward, we order clever lenses for them, and then we operate them just a couple of weeks later usually. If you imagine the eye is spherical, and in order to see, you've got to focus the light onto the retina. A lot of people who are long or short-sighted, the focus is not on the retina, so they need really thick spectacles. We take the lens out from inside the eye, effectively cataract surgery, and replace it with a synthetic lens. And in order to work out the power of that lens, we work out the length of the eye, the curvature of the cornea, plug into a clever calculator, and that says if you put X power lens into the eye, it focuses on the back. Astigmatism is also important. Astigmatism is the rugby ball shape of the eye. The cornea, the clear window at the front, should be spherical. But in most people, they have some degree of rugby ball shape. And if you just do ordinary cataract surgery on those people, then they're left with a rugby ball shape and things aren't in focus. I've got clever electronic kit here, so the computer actually scans the eye, and then on the operating table, I see a head-up display which actually shows me where the eye is, and so I can take away that astigmatism. That's one of the things which we do here exclusively in the East Midlands. Every patient really sticks in my mind. This is all about giving people the best care, and just hearing them say they're happy is fantastic. But there are a couple who I stick out. One is a young gentleman who had congenital cataracts, so he was born with cataracts. He had his lenses out, and so ever since then he's been forced to wear jam jar bottom glasses. It's not a good look, and it's been driving him absolutely crazy. At the age of 23, it's miserable to have to wear those spectacles. He was turned away from several places because they wouldn't operate on him, and in the end we went for it and placed secondary lenses in. So whereas before he had no lens inside the eye, we put a secondary lens into the eye, and the change in his quality of life was fantastic. He went from a situation whereby he couldn't drive and he could hardly go out and about by himself, to a situation whereby he's actually taking driving lessons now. And so we've really transformed his life in a 23-year-old. And that really gratifies me, because he's got the rest of his life. And I hope he still remembers me. I mean, occasionally he's probably forgotten me, but I'll remember him forever and ever. It's all about the care you give. And care is not just the medical or surgical side. It's the whole package. The second people walk in here, I mean, I was amazed by it. It's like an airport lounge. It's fantastic, and you get a warm feeling. The nursing staff are great. The whole patient pathway is fantastic. So from the moment people walk in, they feel at ease. They get a business class service, and that's what I would like to deliver. Circle have invested in the kit as well, and that makes a big difference. If you invest a lot of money in keeping patients safe and giving the best possible outcomes, then I'm on board. And part of it is that my reputation is here as well. So I wouldn't be here unless I could give a gold standard service. And actually, I do that with the kit, with the staff, and also the empathy with the patient. And also, at the end of it all, they want a fantastic outcome, which I can achieve here, and that's why I work.